welcome back to another session of this lecture series. Now, today we will discuss something about fixed dose combination of amoxicillin and clavulanic acid, also called as Amoxiclav. This combination of antibiotic is very much into practice for treatment of various infections. We'll also see some other suicidal inhibitors combinations which are often used in clinical practice because they're most commonly used in medical practice as of now. So let's see what is the role of their combination, what are the concept behind adding these two drugs and so on in this presentation. So very interesting start which I thought of when I was trying to explain you about suicidal inhibitors. Now the first scenario that you need to look at is a room which is a dark room, and probably think of a scenario where you want to read a book in this darkness. Okay, so from all sides, as you can see, there's a lot of darkness here, and it's possibly not possible for you to read a book in this darkness. So that is one thing that you need to understand. Now once you enter the room, what happens biologically is that your pupils dilate. So it's kind of a defense mechanism, because body tries to see darkness as something which is a kind of a fright scenario, and it needs to tackle it. So dilatation of the pupil occurs so that more light can enter the eye and you will be able to see some things even in the darkness. So that is the second thing that you need to understand. So the first is the darkness. Okay, so that's the one thing. The second is the first defense mechanism, that's dilatation of the pupil. Now remember that it's not a foolproof method. It's not a foolproof method. Even though pupils dilate, you will be able to see some things, maybe able to perceive the outline of the objects. But the important thing is that if I tell you to read fine text which is printed on a textbook in a room full of darkness, it's impossible. So this kind of a defense mechanism of dilatation of the pupil fails actually when you want to read a book in a dark room. So that's one thing. Okay, so what you want to do, the next thing is you want to light up a lamp, probably electric lamp, but here I'm trying to show you something other than that. It's kind of a traditional lamp which has oil based and so on. So you light up this lamp and the entire room is full with light. Okay, so then with dilatation of pupil, with what I can say, with the dim light you will get across by lighting up this lamp, you will be able to read the fine text on the textbook. Okay, so if I want to then summarize this thing and then conceptualize you to the core of suicidal inhibitors and antibiotics and the role, then I should say that, come to this picture, there is a lot of darkness around. Okay, so this is what is an enzyme which is produced by the organisms. Okay, so it's trying to nullify the effect of antibiotic by producing enzyme. The first defense mechanism that I talked of is dilatation of the pupil. Okay, so antibiotics, probably amoxicillin like antibiotics, will try to kill the organism. So it's kind of having its own ways of killing the organism and so on, but it's not foolproof. It's not foolproof. So you need to add the lamp, okay, which will give out light. So this is the second defense mechanism. So if this is darkness, these are the enzymes, this is the antibiotic which is trying to act but is not able to act fully because of enzymes which come from all the sides, which will try to nullify the effect of antibiotic. Then you add up the next power, the next generation of power, that's your clavulanic acid or suicidal inhibitors. Now why suicidal inhibitor? The name. The reason to look at this lamp, now you want to look at this entire scenario from the perspective of the lamp. The lamp is trying to utilize oil to burn the flame. So eventually it's on a death row, because the oil is going to last for maybe few hours, and by the time it ends, the flame is going to go out. So it's kind of a suicide for this lamp. So in that, it's giving out light and is trying to disperse that across the room and giving you the opportunity to read. Okay, so it's kind of a suicide for the lamp, but it's doing some good at the same time. Okay, now that is what is the concept of suicidal inhibitor. So it's adding power to the eyes to locate the text onto the fine print of the textbook. So if this is power 1, definitely this is double the power. It's giving you the opportunity, the eyes the opportunity to see, so it's double power. So that makes this combination of amoxicillin and clavulanic acid, the lamp here in this case, which is a suicidal inhibitor, to tackle darkness. You can very clearly see here is a lot of darkness, but as you light up these two defense mechanisms, make it completely, wipe it out the darkness and make it possible for you to read the textbook. So that's the very core concept of a suicidal inhibitor and why you want to add it to antibiotic. We'll come to that in a few slides to come when we deal with antibiotics anyway. So the first thing I need to tell you is something about amoxicillin. So amoxicillin is a semi-synthetic penicillin antibiotic. It's analog of ampicillin. It has good oral absorption. Even food doesn't interfere that much with absorption of amoxicillin. So amoxicillin is a preferred drug of choice nowadays for treatment of various gram-positive and gram-negative infections. Even GIT upset in the form of diarrhea is very less with amoxicillin as compared to ampicillin. Now, amoxicillin, being a penicillin group of antibiotic, has a beta-lactam ring, and its entire activity depends upon the maintenance of this beta-lactam ring. If you break this beta-lactam ring, then the activity of amoxicillin just goes off. So that is very important that you need to just remember when you talk of in general about penicillins, but also is a part of amoxicillin when you want to talk of it. Okay, so there are few enzymes, the darkness part. Okay, so the darkness part in the room. Okay, so these are the beta lactamase enzymes. So these are produced by the organisms, and these enzymes are responsible for breaking up the beta lactam ring. Okay, so that renders the entire antibiotic ineffective. Okay, so the entire activity of amoxicillin is lost, and so organisms become powerful by producing these beta lactam as enzymes, and that's also the darkness part that we have seen. Okay, so the first defense mechanism which we talked of, dilatation of pupil or amoxicillin in this case, is ineffective because these enzymes empower the entire scenario of antibiotic usage, especially amoxicillin, when trying to deal with especially gram-negative organisms. Now comes the suicidal inhibitor, our lamp, which we discussed the example. So clavulanic acid is also available as clavulanic potassium, and that's the commonest salt of this drug that we use. Now remember that it has no antibacterial activity of its own, so that's important. So clavulanic acid, in fact, it structurally relates to penicillin and has the ability to inactivate a wide variety of beta lactamase enzymes. Okay, there are various classes. Now this clavulanic acid basically blocks class 2 to class 5 beta lactamases enzymes. So it blocks the activity of the enzymes. This lamp of clavulanic acid blocks the activity of darkness. Okay, so that's one thing. What happens is that when you are giving, or when you start with the doses of clavulanic acid, the initial few doses are progressive inhibitors, so kind of a reversible binding to beta lactamase enzymes. But as you increase the dose, maybe you want to see more and more enzymes getting infective, especially beta lactamase, and over a period of time, these enzymes will be blocked by covalent bonding, and the result is that clavulanic acid, once getting attached to these enzymes, which lose its own activity. So it's kind of a suicide for the clavulanic acid. So it's doing some good, it's blocking the enzymes, but once it gets attached to these enzymes, the beta lactamase enzymes, it becomes ineffective. the lamp in this case. Okay, so even though it's adding power to amoxicillin, but it's losing its activity, it's dying off. Okay, so the lamp scenario that we have seen. So combination of amoxicillin and clavulanic acid prevents amoxicillin from hydrolysis of beta lactamase enzymes. Definitely they are blocking beta lactamase, and that's the main issue when you are using amoxicillin in cases of gram negative organisms, to extent even gram positive organisms. So if you block these enzymes, then amoxicillin has the full power to go and attack the microorganisms and kill them. Now if you want to see some additional actions, additional sites at which it can block this beta lactamase, is that it also inhibits beta lactamase which are located in the periplasmic sites. Okay, so it enters the cells and blocks these enzymes. This drug induces, to extent I should say, this drug induces chromosomal beta lactamase production. Okay, so because high doses of this drug sensitizes gram negative bacteria especially to produce a lot of beta lactamase enzymes. So this drug has that ability. Okay, but at the same time it inhibits, but it can also induce to extent the production of beta lactamase enzymes. But I should say most of the studies which I have come across just say that 30 to 40% of the species of microorganisms get this induction of chromosomal beta lactamase enzymes by this clavulanic acid. So that's important to note, as far as because that's a limitation to the actions of this drug. But anyway, overall the effects of clavulanic acid and amoxicillin are excellent as far as treatment of various infections, gram positive and gram negative, are concerned. Now if you look at the spectrum of activity, then it will just broaden the activity of amoxicillin, because clavulanic acid on its own has no antibacterial activity, so it's giving more power to the eye, it's giving more, in our example, it's giving more power to amoxicillin. So it establishes, I should say, activity of amoxicillin to a greater extent on gram positive and gram negative organisms, especially the ones who produce beta lactamases. So staph, strepto, enterobacter, haemophilus, moraxella, bacteroids, these are the organisms which produce beta lactamases to extent would be the ones which will be affected by these enzymes. Certain non-beta lactamase producing organisms will also will come under the spectrum of amoxicillin and clavulanic acid given together. Okay, so if you look at pharmacokinetics, then you should know that amoxicillin and potassium clavulanic are well absorbed by gastrointestinal tract after oral absorption. Their pharmacokinetics matches each other, has a plasma half-life for around 1 hour, and in both of these drugs are excreted from the urine within 8 hours, they say. And probenecid does not prolong excretion of clavulanic acid. Okay, so it may have an impact on amoxicillin, but as far as clavulanic acid is concerned, it doesn't have that impact. But anyway, we add it to these drugs, especially by treatment of gonorrhea along with amoxicillin. Anyway, we'll come to those points in a few slides to come. As far as therapeutic uses are concerned, respiratory tract infections, otitis media, that's the ear infection, sinusitis, urinary tract infections, skin and soft tissue infections, mild to moderate infections, especially abdominal origin due to enterococcus, sexually transmitted diseases or STDs in the form of gonorrhea, single dose. I think amoxicillin is 3 grams plus clavulanic acid plus probenecid. So these are the 3 drugs which are combined together and given for a treatment of gonorrhea. It has also been seen that infections which are caused by non-enzyme producing bacteria, very easy to add because they are not producing beta lactamases, so in fact this becomes more powerful, but they are also indicated for infections caused by non-enzyme producing bacteria. So these are few uses of Amoxiclav, that's amoxicillin plus clavulanic acid. Now if you want to look at doses, then you have tablets, syrups, injections available, so dosage formulations which are available. Now tablets are around amoxicillin 250 milligrams, fixed dose combination plus clavulanic acid 125, available as single tablet. Double strength amoxicillin 500 milligrams tablet plus clavulanic acid 125. Okay, Then we have syrups for pediatric age group of amoxicillin 125 milligrams plus clavulanic acid 31.5 milligrams per 5 ml. Okay, so that's also available. Injections of Amoxiclav are available, which might contain a full strength of 1 gram amoxicillin plus clavulanic acid 0.2 grams, or half the strength for injection amoxicillin 0.5 grams plus clavulanic acid 0.1 gram per vial. So these are the strengths of fixed dose combinations that are available. Now depending upon the severity of the infections, you need to either select a tablet. Even age group then less than 5 years, maybe you want to give syrups, or if the severity is more, then maybe you want to give injections, deep intramuscular or intravenous. That's what is given. Especially I should say they are given for 5 to 7 days, but depends upon the severity, you need to extend the therapy even to 10 to 14 days. Now actually speaking, with food or without food should not matter, but then better to give it just before the food, so that absorption of this tablet and syrup is the most. Injection wise there shouldn't be any problem, but then the duration, you need to look at the severity of the infection and then think about how many days you want to give this injections. Of course, textbook says 6 to 8 hourly. My experience is 8 hourly should be the best, especially for most of the infections for parenteral use of these two drugs. As far as adverse drug reactions are concerned and precautions, this drug might cause diarrhea, rash, hypersensitivity reactions, anaphylactic reactions can occur, previous allergies to penicillin or cephalosporins, because they are closely related drugs, so you need to ask about drug allergies to both these drugs. These drugs can cause a mild hepatic impairment, renal functions you need to look at, but then even with low renal functions you can give amoxicillin, just need to give it twice daily, that's 12 hourly, and dose might be reduced, but otherwise should be okay even with impaired renal failure. These drugs might cross the placenta, so you need to look at the scenarios, especially in pregnancy and lactation, but should be the safe one in both these cases, but then need to look at the doses and so on when you are giving it to pregnant and lactating mothers. Okay, so if that was about Amoxiclav, that's amoxicillin plus clavulanic acid, a very excellent drug as far as treatment of various gram positive and gram negative infections are concerned. But the story doesn't end here. We need to look at few other suicidal inhibitors and combinations that are available, especially for treatment of very severe infections, hospital acquired infections and so on. So a quick look at other suicidal inhibitors and combinations that are available. The first of that suicidal inhibitor is Tazobactam. Okay, so it is more potent, I should say, as compared to clavulanic acid. So that's one important thing that you need to understand. It's also a semi-synthetic beta-lactamase inhibitor like clavulanic acid. It's a progressive inhibitor over a period of time. As we saw with clavulanic acid, the progression will turn to covalent binding, and then suicidal inhibitory effect of Tazobactam will come. This drug does not induce chromosomal beta-lactamase production, so that differs it from clavulanic acid. It is administered parenterally, so it's not available as oral form, and it's combined usually Tazobactam is combined with ampicillin, but then you have combinations of ceftriaxone and cefaperazone with Tazobactam that are also used. It is indicated for severe hospital infections or cases which are resistant to other antibiotics. You need to combine Tazobactam with either ceftriaxone or cefaperazone, which are cephalosporins, third-generation cephalosporins, so quite aggressively acting on most of the gram-negative bacteria, even hospital-acquired infections and so on. So you need to add to the spectrum and need to treat various infections. So if you look at the list here, it's used for sepsis, which includes infections of skin and soft tissue, okay, which spread across. Meningitis. Now these drugs, especially penicillin or cephalosporins, may not cross the placenta, may not cross the blood-brain barrier. in a normal individual, but then in inflamed states, the blood-brain barrier is impaired, so these drugs can cross and reach to high levels in CSF, that's cerebrospinal fluid, and reach the brain. So these drugs can be used for meningitis, abdominal infections, which include peritonitis, infections of GIT, that's gastrointestinal tract, biliary system, infections of bones, wounds, infections patients with immunosuppression, okay, so where the spread is rampant, renal and urinary tract infections, respiratory tract infections, especially the lower ones, but then also can be added for ear, nose and throat infections, okay. Genital infections including gonorrhea, you can be using sulbactam combinations with other antibiotics, and perioperative prophylaxis of infections, so there also you can be using sulbactam. So it's a good drug, safety margin is also okay. You need to add it to some other antibiotic, especially aminopenicillins like ampicillin, or third generation cephalosporins like ceftriaxone and cefaperazone. Now that's combinations might differ from country to country, but these are the combinations that are usually available. But then you don't get surprised by sulbactam combination with some other agent. That can very well happen, but the concept of addition of sulbactam remains the same as that of clavulanic acid. Now remember that these combinations, especially sulbactam, are for hospital acquired severe infections, resistant cases and so on. So I should say, as compared to Amoxiclav, which is more commonly used, sulbactam combinations would be only for the higher order infections. Now if I want to look at dosing schedule of this drug, then ampicillin 1 gram per sulbactam tosylate, that's the commonest salt of sulbactam that is available. 0.5 grams of that is available in a vial. You need to give it either deep intramuscularly or by intravenous injection 6 to 8 hourly, okay. We also have other combinations of sulbactam. So we have 1.5 grams, which includes 1 gram of ceftriaxone, that's a cephalosporin third generation, available as sodium salt, plus 0.5 grams of sulbactam as sodium salt. So this is half the strength. You can increase it to 3 grams, where you have 2 grams of ceftriaxone, which is added to 1 gram of sulbactam, which is given 6 hourly. So depends upon severity, depends upon the age, depends upon the body weight. You need to then look at whether you want to give half strength or the full strength of this combination. But whatever it might be, you need to be very sure that the infection is of higher order, hospital acquired, or it is of resistant cases. You also, as I told you, combinations of sulbactam plus cefaperazone, and now here the ratio of these two drugs is 1:1. So doses are expressed in terms of cefaperazone. Mild to moderate infections, you can give 1 to 4 grams, equally divided into 12 hourly. So you can give sulbactam, cefaperazone combination. Again, a substitute, I should say, for ceftriaxone. Okay. Now remember that whatever the case, ampicillin, ceftriaxone or cefoperazone, you add sulbactam, you should not exceed its dose more than 4 grams daily. So that's very important. You can get dry powders, usually get dry powders. You can sterilize, you can reconstitute it by adding sterile water. That's my experience, but you also have normal saline 5% dextrose, which can also be used for reconstitution. Okay, so that's also prior to giving injections, you need to just reconstitute it, see to it that there is no turbidity, and then try to give the injection and so on. As far as adverse drug reactions are concerned, pain at the site of infection, if you're giving it by intravenous route, then thrombophlebitis, that inflammation of the veins, it pains also, skin rash, diarrhea, hypersensitivity, raised LFT. Now since I'll be adding cephalosporin, I need to look at bleeding tendencies, because bleeding tendencies can increase, so that's one thing that cephalosporins do. So if a patient is having low levels of platelets or any other blood disorder, then better to avoid any cephalosporin combinations along with sulbactam. Okay, so again a very good drug, very good combination, very good suicidal inhibitor, alternative to Amoxiclav. But remember that these are for hospital acquired severe infections, uh, and not very much for the lower order infections which can be treated on a OPD basis. Sulbactam, as I told you, is available as parenteral form, whereas clavulanic acid would be more of powder form, though even though injections are available, but then you also have tablets and syrups of Amoxiclav. So big difference between where you want to use sulbactam and where you want to use clavulanic acid. I hope the point is made clear to you. Before moving further to the last of suicidal inhibitors, that is Tazobactam sodium. Okay, now it's also a beta lactamase inhibitor which is given by parenteral route, and its pharmacokinetics is very similar to piperacillin. Okay, so this is also a kind of penicillin group of antibiotics, higher order penicillins I should say, where you want to use Tazobactam in combination with this drug. It's used for very severe infections like peritonitis, pelvic infections, urinary tract infections, respiratory tract infections by beta lactamase producing bacilli, especially hospital acquired, including Pseudomonas. So I said to you, higher order, hospital acquired, resistant cases, Pseudomonas. So again, sulbactam, Tazobactam are the ones which you want to use, and not something like Amoxiclav for this kind of infections, nasty infections. Doses would be 0.5 grams combined, it should be grams, combined with piperacillin of around 4 grams injected IV over 30 minutes 8 hourly. So that's the dose of Tazobactam. As far as ADAs are concerned, not big difference. Pain at site of infection, thrombophlebitis, rash, diarrhea, hypersensitivity are a few I should say ADAs, that is adverse drug reactions associated with combinations of Tazobactam, piperacillin. Okay, so I hope that made it very clear what are suicidal inhibitors, especially 3 drugs in this class. That's basically clavulanic acid, or also called as potassium clavulate. Second would be sulbactam. The third is Tazobactam. And their combinations with amoxicillin, ampicillin, third generation cephalosporins like ceftriaxone, cefoperazone, or it might be penicillin group of like piperacillin and so on. So we learned so many things today as far as suicidal inhibitors are concerned. Do keep watching this channel. I hope you got whatever I wanted to say. Now since you have come to the very edge of watching this video, I hope you press the like button, because that gives us a lot of motivation to do more videos and bring you more stuff, quality stuff to you. Thank you. Do subscribe. Bye. See you.